Antibiotics are becoming less effective in fighting infections as bacteria are increasingly becoming resistant to them. MSD, one of the world's largest pharmaceutical companies, believes that vaccination plays a crucial role in the prevention of infections throughout a person's life. Saville reports now on the role of vaccines in the fight against antimicrobial resistance.
There is growing recognition that vaccines are one of the key tools for tackling antimicrobial resistance, or AMR. Vaccinations help prevent infections, both bacterial and viral, and so reduce the need for antibiotics, which are all too often used inappropriately for viruses such as flu. The recent rapid rise of superbugs is causing tens of thousands of deaths each year in Europe alone. In any hospital, doctors can find there are few effective antibiotics left for some infections.
Part of my working day is to make those difficult decisions in terms of which one do I choose, and after a while they're no longer that useful anymore. Those antibiotics have been rendered, if you like, helpless in the face of resistant organisms. When someone says to you, we're running out of options, I can feel the bleakness in their heart, and I can feel what's happening there. And that's not why I did medicine. I did it to give them hope.
An intensive care unit like this is on the front line in the fight against antimicrobial resistance. The use of innovative vaccines to prevent infections occurring is an increasingly important weapon in the doctor's armoury. At the Department of Health, policymakers stress the urgent need for more vaccines and the effective use of existing ones to prevent antibiotic resistance as well as diseases.
Nature, in the form of bugs, are winning the battle against humans. The post-antibiotic apocalypse is a horror story. It's going back to the 20s, 30s and 40s, where you got a mild infection and it was not treatable, and then you died. We need more vaccines and better vaccine take-up in this country and across the world to prevent infections. Vaccines make our lives livable.
In Britain, there's good uptake of immunisation for children, but less so for at-risk groups and the elderly, even though protection against preventable infections is needed at all stages of life.
When you get to the other end of the life course, we know that influenza vaccination is available and needs to be taken. We do pretty well there. But there are other vaccines against shingles and against pneumonia in older people too. And so we need to be sure that it's not just our children that we prioritise, it's people whenever vaccines are indicated throughout their life course.
Collaboration is key to tackling the global rise of AMR through vaccination. At the Wellcome Trust, academics work with governments and industry to raise awareness of the wider benefits of vaccines and ensure investment in developing new vaccines.
Because vaccines prevent disease, you never see that disease. There are many people who've never seen polio or the symptoms and impacts of polio in their lives. And that's a great thing, but it means we don't necessarily see the true impact and benefit of vaccines.
Creating an effective vaccine is a complex process, lengthy and costly, even with fast-track approval and access partnerships. More vaccines are needed to protect humans and animals if antimicrobial resistance is to be thwarted, and global partnerships will be required to find solutions.
MSD is taking a multi-pronged approach to combat AMR. We're certainly keeping a very active pipeline of new products. Hopefully, in the future, we'll be successful in combating resistance as it emerges. We are working very hard to develop new vaccines for both humans and animals because we do believe that preventing infection is the best strategy for avoiding the use of antibiotics altogether.
To fulfill that vision and combat the threat of a world without effective antibiotics, the work continues to develop new vaccines to reduce infections and help people lead healthier lives.